On to another benign pancreatic condition, but equally as important maybe. The aim of this study was to really look at patients that we'd had labelled with a diagnosis of chronic pancreatitis and see whether there was in fact any justification for this diagnosis. For all of you in the audience, if I were to ask you, tell me about chronic pancreatitis, you would come up with some definition similar to this: a chronic condition with prolonged inflammatory fibrosing process, irreversible morphologic changes, permanent endocrine and exocrine pancreatic dysfunction, or similar words. However, if you were to ask one of your patients, what sort of person do you associate with chronic pancreatitis? They're going to come up with this sort of description: a rather unsavory type of character who may be overweight and drinks and smokes too much. So is this a reasonable sort of summary of a chronic pancreatitic? Well, in fact, it probably is. The vast majority of patients with chronic pancreatitis do have alcohol as the main etiological factor. There are a group of patients, a reasonable size, who are idiopathic, and then other groups with cystic fibrosis, hereditary, autoimmune, or tropical pancreatitis